Hello, White Mountain residents. I'm Brenon Farmer from Adobe Hills Dental, where we're passionate about preventing dental issues. Here today to discuss cracked teeth. Yes, cracked teeth are very common and they frequently can lead to tooth loss. So we're going to discuss today how we diagnose cracked teeth and what we can do to minimize the risks associated with cracked teeth. So let's get started. First, the teeth that get cracks the most frequently are the lower back teeth, the teeth in front of the wisdom teeth, because most people don't have their wisdom teeth. These teeth experience the most forces in the mouth when chewing, so people who clench or grind, they're going to exert the most forces on these lower back teeth. That's why they break the most frequently. The second most common teeth to get cracks are the two teeth behind the canines. These are called bicuspids or premolars. These teeth break the second most frequently because of their anatomy, their shape. It's more prone to fracture because of that. So what weakens teeth to cause cracks in teeth? One culprit are large fillings. Large fillings weaken the teeth, increasing the risk of microfractures to occur in the teeth. Now, these microfractures, they start to join and they form cracks. So here's an example of a tooth that I had to extract for a patient because it cracked and broke. You can see that this crack extended all the way below the enamel onto the root surface of the tooth. When a crack gets that extensive, there's nothing that can be done but extract the tooth. So, how do we diagnose a crack in a tooth? How do we know that one crack we should treat and others we shouldn't? So here are the steps that we take at Adobe Hills Dental at identifying teeth with cracks and recommending treatment for such teeth. First, cracks can be seen. So a dentist can see the cracks. Second, cracks can be felt. When a crack gets big enough to where the dentist can feel it with his instruments, that's reaching a point at which I start recommending treatment to protect the tooth. You can see in this tooth, the crack is hiding below where the filling was taken out. And all that was left was a little crack over here and over here before the filling was taken out. So we have very little bit of information, but we've got to catch these early so that we can prolong the life of these teeth for our patients. So visually, so we can feel these cracks. The other thing that we'll use is this little guy here. This is called a probe. You'll notice it has some white and black measuring tips on the end. This is used to measure the gums around the teeth. Where there's a crack, we will get deeper areas with this probe. A normal healthy tissue will be 1 to 3 millimeters deep. And it gets deeper than that, we start worrying about either periodontal disease or cracks. But the telltale sign that there's a crack in the tooth is found when I use one of these. This is called a tooth sleuth. If I suspect that there might be a crack in the tooth, I have the patient bite down on the tooth on this and squeeze and then let go. And as they do that, if there's pain when they let go, that's the telltale sign that there's a crack in the tooth. Now, what's the treatment for teeth with cracks? Great question. The honest truth is there's no definitive treatment that will ever stop a crack from growing. But there is treatment that can slow the crack from growing. So it's very important as this crack starts to form and to grow that we catch this as early as possible. Because if we catch it early and we put a crown on the tooth, that will slow the growth of the crack. But it can progress. If the crack progresses, it may reach and start causing inflammation in the nerve and the blood vessels in the tooth. And then you're looking at needing a root canal in addition to the crown. And then we get the catastrophic situations where the crack extends beyond where the nerve is onto the root surface and breaks and can break the tooth and make it unrestorable. So, I want to share a story. I myself have experienced a cracked tooth. I have a tooth about 9 years ago that had to have a root canal and a crown done on it. Now I know that the crack in my tooth is continuing to get worse over time. But I hope I live a long time, and I hope that tooth outlives me. But in the back of my head, I'm thinking at any point I may end up needing to take that tooth out and get an implant. So I know all about cracked teeth. Do you have any teeth that you might think are cracked? Do you have sensitivity to hot or to chewing? If so, you should go see your dentist. If you don't have a dentist, we'd love to be yours. You can go ahead and give our office a call at Adobe Hills Dental, or you can book an appointment online on our website. We'd love to help you. And just remember, at Adobe Hills Dental, we cure dental fear. Ciao.